There's so many things that make Stanford Healthcare special. We have exceptional people, and we feel we have a tremendous responsibility as nurses to make sure we help elevate the health system equally to that brand. Our Caritas program in Watson Caring Science has been so important in the work that we do.
The essence of the theory is human caring and the language of the 10 Caritas processes, but where the theory lives is in the caring moment. So the caring moment is all you have.
The Watson Caring Science integration journey at Stanford began almost 2 decades ago when individual units were incorporating Watson Caring Science into their mission, vision, and values. In 2013, Stanford Healthcare hired their first Caritas coach.
As a Caritas coach, I think one of the best things that we can do is to live the Caritas processes through our daily actions and behaviors. The Caritas processes keep me grounded.
Caring Science has taught me that I need to care not only about the patients and the staff, but also myself. In caring about myself, I am able to care for others equally as well. So here we have pictures sent by our staff on what they do for self-care. I invited the staff to share pictures of what they do for self-care so that they can inspire others.
I learned how to prioritize my mental health and self-care activities. And that to me brought a lot of changes in my life, not only at work but also in my family.
It's an awakening. We're getting back to being healers. We're getting back to being able to recenter. We want to be modeling that behavior and that love and compassion, and we want to be doing that for ourselves so we can then in turn take care of each other.
Every huddle I start the huddle very intentionally. We have a mindfulness or a grounding activity, and that's something that I'd never done before. And so being able to pause for a second and show to the staff members that I'm working with, like, hey, let's take a minute, let's take care of ourselves so that we can be present and prepared for this meeting, I think it says a lot.
Here we have of our pause pouch. It was something that we came up with to give to our staff to kind of give them a boost of confidence and something encouraging.
We've personally had situations where we've had a patient pass, and that's very emotional for our staff as well. And so giving them an opportunity to take a break and get a little chocolate and decompress from the moment so they can get back in the ring has been a game changer.
So at the end of your shift, offer some gratitude by placing any of these colored hearts in the jar. What I'm most grateful for is basically having all of you guys support me.
I tell this story, it's about a patient that was extremely difficult. So the primary nurse actually asked me to come in and take over. This patient was just going over everything about the care, and I just literally just sat there and just listened. Afterwards, the patient basically told me, wow, I can't believe it. You're the first nurse that actually I felt like was here listening to me. And then she teared up, and we had a great relationship.
So we wanted to make a shout out board where it was an informal way for nurses to recognize their coworkers and other staff members. But a big thing with the Caritas is the healing that goes into it, and having positive affirmations or very nice comments really uplifts everyone.
Caring Science is so important because I've always had this thought in mind that when we provide care for patients, we should treat them as if they were family members, close friends, and how we would want the care provided to us if we were those patients in those beds.
A lot of our patients in the ICU, unfortunately, are placed on comfort care. I can just kind of see how families are having difficulty processing, like, how do I honor my loved one? And so I sort of have talked with patients' families. Let's do a bath where we go from head to toe, We express gratitude for every part of the body and what it embodied, and share memories that were involved with that. It's something I call a spiritual bath.
Which is what Caritas to me is all about, dealing with the whole patient, not just the physical aspects, but the mental, social, emotional needs of the patient. And that goes for the staff too. I think it's interchangeable. What I do as a manager with the staff is also what, as a nurse, we do for our patients.
What I was able to see from the information provided regarding our cohort, we are seeing a higher degree of professional fulfillment within that workforce. And the other thing that I think we see is compassion, the self-compassion, which is so important in resiliency.
Caring science theory, honestly, it's extremely transformative. By taking a moment, taking that patient and their loved ones with all the vulnerability they're showing in their eyes and acknowledging where they are at in that moment, it really changes the entire trajectory of what their ICU experience will be.
So when you take care of yourself, when you have purpose in the work that you do, when it has meaning for you, you come to work, especially here in the hospital, and you see your patient as your partner. The nurse can become the healing environment.
So your consciousness, your intentionality, your authenticity, your ability to be present in that moment with another, to listen, to receive them, to connect with their life experience, etc. That is where the theory actually lives. So that's the essence of the theory, is the transpersonal caring moment.